Living Live are concerned about your heart health. That's why we teamed up with the Mayo Clinic to bring you tips and some simple to follow strategies to keep you beating strong. So joining us this morning, Dr. Stephen Lester, a cardiologist from the Mayo Clinic, came in today to explain to us just how important it is to know your numbers. And by knowing them, you in the privacy of your own home can figure out your risk for heart disease. Welcome, Dr. Lester.
Welcome, glad to be here.
Always good to see you. So we're talking about online tools that are available. How easy are they, and do they work?
They do work, and they're easy to obtain. These tools are really just models or risk calculators that you can find for free online, or as an app that you can download onto a smartphone or a tablet device that allow you to take some risk factors that are known for having a heart attack or a stroke, and you plug them into one of these models, and then it gives you your risk of having a heart attack or stroke generally over the next 10 years or so.
And that's pretty amazing to be able to do that, but I know that you say that there's some important numbers that we need to have in order to really make sure that we're putting in the accurate information and getting the accurate reading. What are those numbers?
Sure. So things that you're going to need to know, you're going to need to know your blood pressure, you're going to need to know your blood cholesterol levels, like you see here, and your good and bad cholesterol is about blood sugar.
Okay.
Now for your blood pressure, that's easy to test. You can go to your local pharmacy or grocery store or anywhere where there's an automated blood pressure cuff. But to learn about your blood sugar and blood cholesterol levels, those really require a blood test.
Okay, so how easy is it to do these online assessment tools? I mean, once you know your numbers, can we do this in a matter of minutes? Do we need to take, 20 minutes out of our day?
No. Once you have this information, it's really pretty quick and simple using these online tools to be able to plug in these numbers and to identify what your risk actually might be.
All right, well, let's talk about the results and what you can learn from them. Let's bring up this first full-page graphic here for us, because what this is showing, this is a woman, a 59-year-old woman, who used the tool and entered her information. What are we looking at right here, Dr. Lester?
Sure, so this is the tool. She's put in her age, and here's her cholesterol levels, both the bad and the good cholesterol levels. She put in her systolic blood pressure. That's the upper number on the blood pressure recordings.
Okay.
You see here she does take medications to treat her blood pressure, and that she's a smoker.
Okay.
And over on this side here, you can see that she does not have diabetes.
Okay, and then up here, this is the number that we're looking for, and this is telling us what?
Right. So once you do this, this tool gives you an estimate of your risk. And you can see here that her risk over the next 10 years is about 13% of having a heart attack or a stroke. And with optimal risk factor control, that really should be about 2% or so.
Okay, now let's go to the next scenario. This same woman now, over a period of time, has made some changes. And what are we looking at here?
Right. We all know that smoking is like pouring gasoline on the fire of cardiovascular disease. So all that happened is this woman decided to no longer smoke.
Okay.
And when we do that, we can see that her risk went from about 14% all the way down to about 6%, so cut by more than half.
Significant. She went on to make more changes, the same woman. Let's go to that next scenario here. And here's what happened. Explain this to us.
Right, so all prevention strategies really begin with lifestyle changes. So she begins to make some different choices in her life, such as the foods that she eats, perhaps trying to avoid processed foods, decreasing the salt intake in her diet, becoming more active. And when she did this, her blood pressure remained the same, but she's no longer on blood pressure lowering medication.
Wow.
Her blood cholesterol dropped a little bit by about 10%, and her risk, again, as you come up here, drops again almost in half from where it was before. So significant.
Yeah, absolutely. So, I mean, just by making those simple changes, and you say all the time, eat right and exercise can go a very long way. Dr. Lester, thank you very much for introducing us to these tools. Now, to make an appointment with a Mayo Clinic cardiologist and learn more on how to manage your risk for heart disease, call 480-301-8200. The assessment tool Dr. Lester just talked about is heart@heart.org. And there's also a mobile app. It's ASCVD Risk Estimator to push in your numbers that you obtain from a doctor. All right, so now here is your chance to keep your entire family heart healthy from ABC 15. Mayo Clinic and Seasons 52, starting today at noon, you could win one of 15 $100 gift cards for a fabulous heart-healthy meal at Seasons 52 Fresh Grill. How can I win, do you ask? Well, sign up for our newsletter, and there's a chance you could be a winner. Sign up at abc15.com/rally4red. Not only will you get the chance to win, you'll receive our monthly newsletter full of tips, recipes, and useful information to keep you and your loved ones heart healthy. Again, that starts today at noon. All right.